Hello, thank you for attending today. We will be highlighting some of the new features and our core tools within Population Explorer. My name is Jeffrey Bahen. I'm the Associate Director in Training for CRISP Shared Services. I've been with the company for roughly 13 years now, and I think I've spoken to quite a few of you. But if I haven't, that's me. So if you have any questions after this, feel free to reach out to me. Okay, so here's the outline of our session. First, we will start a brief reminder of what these tools are and why they are used. Next, we will cover the new features added over the past year to InContext, then to do the same with CEND and Population Explorer. We will then open it up to questions. If you think of any as I move through the content, please feel free to add them to the Q&A feature. This presentation is intended for users um, I'm sorry, this presentation is intended for users who have used or have general understanding of InContext and or Send Population Explorer with the goal of raising awareness of all the new features they could utilize. If you're unaware of these tools, additional resources and full demos of InContext and Population Explorer can be found on our website. Users who cannot see these tools or tabs within InContext may have PDMP only or non-HIPAA access to CRISP. Check with support at crisphealth.org if you're unsure. InContext is our clinical application tool. It could be embedded within an electronic medical record or accessed through our CRISP portal. Users use it to review and search for all the clinical data that CRISP has on a patient treating or managing for. CEND stands for CSS Event Notification Delivery, and it's CRISP Care Coordination Data Feed. CEND uses an organization's list of active patients, also known as their panel, to generate alerts when certain patient events occur. For example, hospital encounters or potential drug overdoses. The Population Explorer, on the other hand, provides an interface within CRISP portal for users to review and filter the SEND data. Population Explorer allows users to create custom filters and quickly jump through the InContext app if they need more clinical data to contextualize the care coordination of a patient they might need. Okay, now that we've reviewed the background of these tools, let's discuss on how we've improved their functionality through the new features. Let's start with InContext. This slide provides a deeper understanding of the available data types within InContext of the application. Demographics, including next of kin, medication management, clinical data, including encounters, clinical notes, labs, radiology reports, CCDs, problems from allergies, immunizations, vitals, and procedures, care coordination, claims, social needs, and my patient summary, which is one of our new features. The major theme that you'll notice that each of these tabs has multiple sub-tabs. It could require multiple clicks and scrolls to get the data that you need, maybe urgently. To help address this issue, our engineering team created My Patient Summary, a customizable dashboard that lets users pin multiple data tabs into a single page. This feature helps in three ways. One, it improves understanding of patient history by centralizing relevant information. Two, it enables customization of the user experience, allowing individual users to tailor their view to their needs. And probably most importantly, it eliminates the repetitive time spent clicking through InContext, looking for commonly assessed data. The feature automatically saves your preferences, so you'll be able to see the same data for every patient you view InContext. You could also use My Patient Summary as your default tab InContext. So it opens as soon as you launch InContext. We will now walk through how to set up your My Patient Summary dashboard. To add the sub-tab to your My Patient Summary dashboard, first go to the Data tab or sub-tab you wish to include. Click the pin icon next to the subtab title. You may add up to 8 subtabs using this method. Once you have a few subtabs added, you can customize the order in which they will appear on the dashboard by dragging them up or down or left and right in the window. To remove the subtab, click on the pin icon again. The dashboard will display your most recent changes when you use it next time. To set the My Patient Summary as your default view in InContext, open User Settings at the bottom of the left menu, move to My Patient Summary to the top using the up arrows, and remember to click Save before exiting. We really believe My Patient Summary will improve your experience with the InContext app. Now let's look at how lab data is being presented differently through the tool. This image shows how labs are traditionally displayed within InContext in a table format. While you can filter and search the data table, it's hard to quickly see changes in lab values over time. So the team deployed the lab timeline view, which always shows users the changes in the same lab values over time. You can look back over the last 5 years to help users more easily identify changes in patient labs and see trends over time. We hope this view will save the user time, limit clicks and searches, and support more informed decision-making. Our team has also been working to parse information from CCDs into subtabs of different health data categories. CCDs are a standard electronic document format that summarizes the patient's medical history for sharing among providers. These documents typically include specific sections of data such as allergies, medications, problem lists, also known as active diagnosis, lab results, vitals, procedures, and care plans. In CRISP, you can find, review, and export the full documents, but now our team is also breaking down and consolidating all these categories of new data from all CCDs received into a single patient into subtabs for easier review. This slide displays the available subtab data: problems, immunizations, allergies, vitals, and procedures. One quick note about the immunization subtab. The subtab contains data from InUnet, Maryland's immunization information system. A new subtab in the medical management section has been added to the display of non-CDS medication data. I am not going to cover this section in detail now because our own Maya Gottlieb will be discussing medication data in CRISP, including this new section during the summit today at noon. So please attend that session to learn more about the new subtab. Some more data that has been added to InContext is Exact Sciences Cologuard data. Providers can now find the results of these tests and structure the documents in. Lastly, we improved the user experience of InContext to highlight the current tab with a light blue highlight and added a display to alert new users of the features added to the tool since the last time they reviewed the subtab. All right, let's shift gears and discuss the noteworthy updates to our care coordination stack, CEND and Population Explorer. My first point to draw your attention to necessarily isn't a new feature, but one that many users overlooked. While it is true that CEND, event notification delivery, primarily delivers encounter information, it is also built to support event delivery on other health events. For example, on this slide here, you'll see 3 different notification types. The first one is an emergency encounter, which is a standard encounter notification that users know CEND for. The second one is what we call a logic-based notification. These notifications are triggered by encounter activity combined with additional clinical criteria such as diagnosis codes or defined conditions. They support more targeted scenarios, including maternal health, chronic conditions, post-surgical monitoring, and risk-based follow-up. Organizations must send a request to CRISP to staff these up and to require data to ensure that your organization is sharing correct quality data and appropriate configurations to fill these notifications. The third type presented here is the global notification. Unlike logic-based notifications, all the users with access to CEND data and/or Population Explorer will receive these. The three ways we currently have a death indicator, non-fatal overdose alerts from EMS and non-fatal overdose alert from a hospital setting. Our user engagement team at CRISP is working hard to build comprehensive documentation of the menu specifications for the logic-based alerts over the next few weeks. Users and organizations interested in setting these up for CEND data feeds should contact us at marylandcommunications@crisphealth.org to learn more. One additional data point that's captured in Population Explorer is preventive services. These are screenings and not technically notifications. This is why they're displayed separately in Population Explorer. These are available by default in Population Explorer. No requests enabled to get these feeds as needed. Currently, we display collateral and colorectal, breast, and cancer screenings. The team is working to add cervical cancer screenings in late May or early June. These preventative service screenings appear in the Population Explorer in green, and users should double-click the patient record to launch InContext and view the full screening source document within the structured document or health record subtabs. Our last feature to point out in today's presentation is that users can customize the column order of data exports from Population Explorer. Users have always been able to select and deselect the data fields they export, but now they can configure the order in which the selected data fields appear in Excel to export the streamlined data and ingestion or analysis. All right, that covers all the new features we wanted to touch on. We now can open it up to questions, but before we do, there is a QR code on your screen which links our post-summit survey. Users are welcome to provide us with feedback on what we can do to improve these sessions after they conclude. Now I'll turn it over to Kevin to read out any questions that we may have. Thank you.
Thanks, Jeff. Before we get to questions, I do want to kind of piggyback on Population Explorer and in context. If you want to learn more about those tools, we actually have webinars that we run bi-monthly on both of those, where we do demos, cover any new features that have been added since the last time we talked about them, and just spend a lot of time answering your questions specifically about the tools themselves. So if you're interested, you could go to our website, which is listed there on the screen, crisphealth.org, and we do have a upcoming webinars button at the very top right corner of the screen where you can click and you can register for the upcoming events that we have. We also have sessions on CRISP in general, the HIA admin tool, and a few other services such as social determinants of health data, CRISP reports, and things like that. So you can find all of that information there. One question, Jeff, that I saw come up is in the My Patient Summary, folks are just asking us to maybe review again how you actually can set that as your default view. So I don't know if you want to talk through that again really quickly.
Sorry, I was on mute. Yeah, so when you are in My Patient's summary, you could click on the user settings. And actually, anytime you're in context, you can click on the user settings, and you can use the up and down arrows to bring what you want the default to be, towards the top. And once you do that, you could save it. Now it's important to hit the save button. I've seen a lot of users, get everything the way they want it and then forget to click save. And unfortunately, when you do that, it's not going to save it for the next time. But if you do click the save button, you're going to end up, with the view that you want every time. And also, too, if you ever need to change it, you can just go back in and change it.
Thanks, Jeff. Another question that I think might come up just from us covering this. Um, in the Population Explorer tool, you can actually launch in context. So on one of these records that you're seeing on the left side of the toolbar, you can actually hit right click and then you can launch in context. So I think you alluded to it when you were talking about the preventative services, but you can actually view the full document for this in the structured document tab or the health records tab within InContext. And so the way you can do that quickly is just right clicking from the patient record that you want to see more of. So I did want to point that out just because we were talking about that and thinking about that.
Yeah, that's
Alrighty.
correct. It saves a couple of steps there. And eliminates the need for you to have to enter first name, last name, and date of birth to perform the search.
So Bruce is asking a question about um, patients and how data flows in. I think if I could summarize his question, um, I don't know if you have any thoughts about if you want to touch on how we receive patient data, Jeff, and how we disseminate that data.
Um, yeah, I'm looking here at the question. Yeah, which patients are eligible to participate in? How do patients do the participation? Basically, with these, if you want to reach out to your account executive, and if you don't know who that account executive is, you could always reach out to support@chrishealth.org, and they could get to you, a pretty detailed overview of those and who can get what.